Hey guys, it's Bear. It is Thursday, July 1st, 2021, and I want to address a question in this video that I get really often. So, if you're first turning into this channel, I'm a transgender male. That means I started out life as a female and transitioned to male later on in life. And I'm also a member of the United States military, and I entered after I transitioned. So, the ban on trans people was recently lifted again, and we have a large group of trans people that are now trying to enter the military, and they're going through a process that is similar to what I did back in 2018 and 2019. So that's why I'm doing these videos. So my last two videos rather, I talked about the MEPS process, including paperwork and the actual day that you go to MEPS. And I want to clarify something um, that I kind of glanced over in that video, and I apologize for that. It's one of those things that, yeah, it came up for me, but honestly, it was such a minor thing that I forgot to talk about it. And that's the matter of um, underwear. So I talked about the fact that you have to wear underwear when you go to MEPS because you're going to be doing like uh, flexibility and dexterity exercises in front of doctors to make sure that you can like withstand going through BMT and whatever your tech school is. I did not talk about the fact that um, applicants have to wear specific underwear, and this is in the policy. It's page 3, paragraph 2, subparagraph A for transgender male applicants, specifically B for trans female applicants. Um, I always address things towards the trans male point of view because that's who I am. So, subparagraph A says transgender male applicants who have not undergone surgical/hormonal therapy will wear undergarments consistent with their physical anatomy as per routine in U.S. MEPCOM regulations for all applicants. They will be administered a pregnancy test if applicable and will receive medical examination specific to female anatomical characteristics. So I talked about that last bit in my MEPS video, so I'm not going to get too far into that. Yes, you'll be treated as a male, but you still have to have an exam that goes along with your anatomy, and you'll have the appropriate chaperone in the room depending on what doctor is examining you. But what I kind of glazed over was the bit about the undergarments consistent with your physical anatomy, and this um it's freaking people out just a little bit. People think that because they were born female and they may not have had bottom surgery that the people at MEPS are going to expect them to show up wearing specifically female like underwear, i.e. panties, and that is absolutely not the case. So I want to put people to rest right off the bat that that is not what that is stating. You can go ahead and wear your briefs or your boxers or your boxer briefs. Boxers can get a little bit uncomfortable when you're like getting down and doing the duck walk and stuff like that, and so they suggest you don't wear boxers, but you wear something a little bit more form fitting. But regardless, it is not telling you that because you were born female, you have to wear like women, female gendered underwear. That's not what that's saying. What that's saying is that if you have not had top surgery and you still have breasts, you need to cover them with appropriate undergarments. And yes, as a trans male, is it dysphoria inducing to have to wear a bra or a sports bra? Absolutely it is, but you have to remember that you're in a professional environment and you have to dress appropriately. So if you are a trans male who has not had top surgery and still has breasts, you have to wear some kind of undergarment when you go to MEPS. So that's not saying it has to be like a bra per se. It could be a sports bra. Some people have asked me whether or not they can wear a binder. The answer is I really don't know. Nobody's really had to address that because for the most part, everyone I know that's gone through MEPS post transition has had top surgery, so it hasn't been applicable. I don't think that MEPS is going to really have a problem with you wearing a binder. Um, it can be constricting though, and that comes to the next part of the video I want to talk about which is what to do if you go to BMT and stuff without top surgery. So as far as the MEPS day and the fact that you have to wear, appropriate undergarments, that's what that's talking about. You have to wear something that covers your breasts. So ask your recruiter if you can wear your binder. I don't see why they would necessarily say no. However, the next part, BMT. What are you going to do when you get to BMT and you haven't had top surgery? So, this is the one that I get a lot. People probably message me on average once a week, if not more, saying, "Hey, I'm a trans guy. I want to enter the military. I've been on hormones for X amount of time. What do you think is the next step I should take?" And we always end up talking about whether or not they've had top surgery. Bottom surgery never comes up. Bottom surgery is really not a big deal. But the fact that you are going to enter the military as a male with breasts, it's something to consider. So there's a few things to think about. One is the fact that you're going to be, surrounded by 50 some odd other males your entire time at basic training. Now, the various branches have different lengths of time for basic training. I'm in the Air Force. We do 8.5 weeks. But you are in one big room living together, and the next bed is less than like 3 feet away. You have absolutely no personal space. You have no privacy. And they don't want you to have too much privacy because there's a lot of stress in BMT, and there's a risk that people may not be able to handle that amount of stress and unfortunately try to hurt themselves. There's a lot of focus put on self-harm and suicide in the military in general because it's a problem, but especially in BMT, that you are like never alone. The only time you're alone is when you're physically in a bathroom stall, and even then, if you take a break from class to go to the bathroom, you have to have somebody go with you. So they never ever want you alone. You have no privacy, y'all, is what I'm trying to say. So trying to go through that process while you have breasts is going to possibly cause some issues for you. Is it allowed? Yes. As far as right now, surgery is not a requirement for going into the military, period. But you really need to stop and kind of consider what you're thinking about undertaking. It's not a comfortable experience in the first place, basic training, and then whatever your technical school is, and then the military. It's not a comfortable environment. You are making sacrifices, and the period of time that is BMT is one of those big sacrifices. It's just uncomfortable the whole time, and like for lots of different reasons, but mostly because you have no personal space. So for me personally, as someone who went into the military at age 38, I was used to having my own apartment or an apartment that I shared with one or two other people. Living in a dorm room with 50 other people who were half my age, it was uncomfortable, and there's times that I definitely got really cranky. So are you going to want to be in that environment as a male, as a trans male who is, kind of a minority, and also add to that the fact that you've still got your breasts? People are going to notice. There's absolutely no way around it, especially because there's the open base shower situation. So again, as far as the Air Force is concerned, all the dormitories still have that open bay shower. Some other branches have shower stalls, or they have smaller shower partitions with 3 or 4 shower heads, but you're still going into a communal shower, and you have to shower. You cannot get through training as somebody that's not taking care of themselves and maintaining hygiene. That's going to be a red flag, and it's going to cause issues for you. You have to shower. So think about that situation as far as going into an open bay shower with 50 other candidates. Now, I talked about this in a prior video, my trans BMT video part 2, I want to say, back in May of 2019, right after I graduated. I have had top surgery, and I have not had bottom surgery. So one of the ways I maintained my own privacy in the showers was I wrapped the towel around my waist. and I went to the shower head and then kind of threw the towel up on a shelf or over the shower head. Did mostly most of my shower facing the wall, and I just wrapped that towel back around me and left the shower. Also, people aren't really looking at other people and so forth. People don't want to make other people uncomfortable. They don't want to be accused of being gay. You know, hey, why are you checking me out in the shower? Stuff like that. But so there's what I'm trying to say is there's a certain matter of discretion. But if you have significantly sized breasts, it's going to get noticed. So consider whether or not you want to be in that situation. The other thing is, a couple people have said, "Oh, well, it's no problem. I'm not shy." That's cool. I mean, if you're like body positive and you're not shy, you don't mind the other trainees knowing that you're trans right away, like, more power to you. Honestly, that's great. Some people are shy. They want to be stealth. They don't want to be harassed or have anybody ask questions and stuff like that. So obviously, for them, this is something to really consider. The other thing, though, is wearing a binder in basic training is going to cause its own issues. So the shower aside, you're going to have to do something about, your anatomy throughout the day as you're training. Again, if you are totally comfortable with your body and you have no problem throwing on a sports bra and running around and doing your basic training as a male with breast tissue, great. Then you can stop watching this video right now. Then you're fine. Go, do it. If you're trying to wear a binder, though, because that's what most people fall back on. Most trans males, I'm probably going to get in trouble for saying this, but most trans males are not really happy with their chest. Many of us don't like having breasts, and it causes us dysphoria, or we at least want to try to present as male to the world so that we don't get misgendered. So many of us wear a binder, or we do something to flatten our chest and give us that male presentation. So wearing a binder is the thing that people fall back on for their solution to the BMT problem. Oh, I'll just wear a binder. Two issues. One is you are going to have to meet time requirements when you shower on a daily basis. And that's in the morning and in the evening. You will have less than 10 minutes to get undressed, get in the shower, get dried off, and get dressed. And oftentimes in that 10 minutes, you also have to have your night display set up for your evening hygiene. Your uniform has to be hung up and ready to go for the next day. So it's not a lot of time. And honestly, it's to get you used to moving quickly and, having to come up with solutions for not having a lot of time to get ready. It's just one of those things that they make you do in the military. They make you hurry. And that's the big one. And my flight struggled with it the first 2 weeks of BMT. It was really hard to get all of that done in less than 10 minutes. And when you don't get it right, you do suffer losses for it. So you'll get less time for your shower the next day, or you'll lose some other kind of privilege that you're looking forward to. So being able to have free time later on in BMT, you're given a little bit of free time to go various places on campus. They'll take away that free time. If you mess up bad enough, and this is way past your shower time hacks, but if you mess up bad enough, you'll lose family time. And that's a big one, right? After you've spent time away from your family for 2.5 months. You don't want to lose that time. Point that I'm trying to make is that trying to add to that time hack, getting your binder off and then on, it may slow you down. And I for sure don't want to be the person on the team that's taking the longest and losing everyone else their privileges. So that's something to think about. But the bigger one to think about is the fact that binders can pose a health risk. And all of us should be paying attention to how many hours a day we are binding and what size binder we're wearing. But a binder is constrictive. It's spandex and lycra, and it is pushing down not just your breast tissue, but it is also squeezing on your ribs, which is where a majority of your internal organs lie, and especially your pulmonary system. So your lungs and your diaphragm are actually being constricted by that binder. And we all know that you should not do physically exerting activity wearing a binder, because you can't get deeper breaths because your torso is being constricted, and you should not wear it for more than like 8 to 12 hours a day. I've talked about this in previous videos. I used to wear my binder for like 14 more hours a day, but I was paying really close attention to my body when I did so. And a lot of trans guys will tell you it really starts to take a toll on your body. It makes it hard to breathe, and it hurts your back, and sometimes will hurt your ribs and can cause a lot of health issues. So being in BMT, where your chances of injury and health issues is actually higher, you're now adding another factor to that. And especially the fact that there are physical requirements to BMT. You will do exercise 6 days a week, either really early in the morning or later on in the evening when it starts to cool off, depending on what season you go. You will also do drills where you are training with your rifle, where you have to run back and forth, dive to the ground, pretend to fire your rifle, and then you'll have a week at Beast, and that's where you do things like the obstacle course. So that's the Air Force. That's not even talking about the Army and the Marines, where they do that stuff more. The Air Force does that stuff for like a week. So that's really something to consider when you're talking about wearing a binder for the period of time that you're at basic training. So those are my thoughts. When I talk to guys who are looking at doing this and they haven't had top surgery, I honestly do urge them to try to get their surgery before they go to basic training. And that's not me trying to be a drag or a downer or dissuade people from doing something. That's me trying to say, these are the things you really need to look at. So I think personally that it is a better idea to have your top surgery and then try to go and enlist, for all the reasons that I just said. It does cause a delay. So going into the military, if you've had a surgery, it's like an 18-month delay for the Air Force, probably different for other branches. There are waivers depending on what the surgery is, but if you, like me, if you have double incision, it's a massively invasive surgery. That 18-month delay is there to protect you. It's there to make sure that you don't go in and have some kind of complication from your surgery or an infection or something like that. So, yes, it will take longer. It will delay your process. But what you have to think about is the long-term ramifications of trying to go in without surgery and having something happen, trying to bind, and so forth. So these are all things to think about. Everybody's different. Everybody's body is different. Some people don't have significant breast tissue, and that's something, a couple of guys have said. They're like, hey, I've got really small breast tissue. I could probably, walk through a room without a shirt on and nobody would even notice. Great, go for it. Some of us aren't that lucky. I had much larger breast tissue, like between a C and a D size cup. So for me, that wasn't a thing. I had to have surgery. My breasts were a real problem for me as far as like dysphoria and also pain. So that was something I did as soon as possible when I started my transition. That was like the first thing I was thinking about, after getting on T, was how soon can I get my top surgery. So these are some things to think about, when making your decision about how to approach enlisting as a trans guy. I know it's a long video. I really appreciate your patience, and I'm sorry I skipped over that in a previous video. Keep sending me your questions, and I'll try to get to them as soon as possible. Thanks, guys.